Let's now come back to Europe, and I'm delighted to introduce James Kennedy, who's the Director of Public Affairs at the European Society of Cardiology, and leading a major campaign to achieve a European action plan on cardiovascular health in the next political mandate. And this is a really exciting time for the cardiovascular health community, including all of us. James, you're joining us online from Brussels. Please give us a little more context and the kind of collaboration that's underway to make this happen. And how has FH Europe Foundation been involved? What are the opportunities for us to continue to invest?
Can everybody hear me okay? Or can the team just give me an indication that they can hear me okay?
We can hear you okay. Wonderful,
the technical
James.
Team?
Great. And we can see you. That's super. Please go ahead.
And thank you very much for having me, and apologies for not being able to be there in person. One of the many hazards from working from home is the connection, but I do apologize in advance for any other household hazards. Just be aware that, as I'm sure many of you can appreciate, no toddler has ever entered a study and said, you know what, you're busy, I'm going to come back later. So my name is James Kennedy. I represent the European Society of Cardiology, which itself represents 100,000 medical professionals in 57 different countries. And we'll talk a little bit today about what, together with FH Europe Foundation in the European Alliance for Cardiovascular Health, the broader group that we're working through, what we've been doing in policy, how we've been going about trying to get plans, and also why we need them and what some of the next steps are. So looking at that, the main mission of the ESC advocacy committee at the moment is to get fully funded cardiovascular health plans for all. And this is in keeping with the broader mission of the European Alliance of Cardiovascular Health, a coalition of 17 organizations, of which ESC and FH Europe Foundation are just two members, to have fully funded EU cardiovascular health plans with national action plans. So why do we need those in the first place? Well, the very first thing worth recognizing is that where society puts all of its attention and its resources is entirely determined by policymakers. And everything that we need, we want, is going to be downstream from that. So whether it is early diagnosis for rare conditions, whether it is more research or treatment, support for staff or patient foundations or whatever it might be, all of that is going to be determined by politicians. Now, if you're in a position to say that you think that you don't need the support of these people, or that you don't need to be involved in reaching out to them, then you're in a position to say that you don't need the support of the most powerful people in your country who quite literally print money. And that is a very envious position to be in. And for us, the big issue is that policy is made by those who show up. So we have to be there talking to politicians about what we need and not taking it for granted that just because these are serious threats, that they are going to be solved by policymakers. It requires banging on the door. It requires getting their attention. So one of the things that we've been doing through each, or we found ourselves doing in terms of tackling some of the obstacles, is really busting a lot of myths around cardiovascular disease, which it seems have actually provided a lot of obstacles to getting funding for cardiovascular health plans across the EU and beyond. And one of those ones is the kind of incredulity that there's no plan already. But the reaction we've had is, well, surely if it's the biggest killer, there's already a plan in place, right? There's already some funding that's attached to this. Well, actually, no. So this is a survey that was done by our 57 national cardiovascular health societies. And what we find is that only 1/3 of all the countries, barely 1/3 of all the countries surveyed, actually had funded cardiovascular health plans. 41% had no plan at all to tackle the biggest killer in their country, and some with a plan in name only, with no funding attached to it. So the very first thing that we have to dispel for policymakers is that it's very likely the case that even though this is what is demonstrably the biggest threat to health in their country, that there's simply no policy plan in place to tackle it. Second one, and one you're going to come across a lot, is that the screening and the funding for these things, it just costs too much. We just can't do it. Here's a breakdown of the EU budget as it is today, right? So I just highlight one because it gets a lot of attention. We spent 56 billion euro funding farming in the EU. Everything that you see there is in the billions, everything from research and border security and green transition and everything like that. All amounts to the total EU budget is 184 billion every single year. Well, there's the cost of cardiovascular disease, 282 billion euro. Now, out of that, let's just point out as well something that should make you mad is that we're also spending 200 million euro of taxpayer money funding tobacco farming in the EU today. So when people say to me that we don't have the money, I hear two things. One is that the distribution of money that we're spending is warped in such a way that we're happy to fund the means to destroy cardiovascular health, but not the means to protect it. And the second is we're spending the money now. We're just deciding not to invest it. So what we're doing is making a decision not to invest in cardiovascular disease today, and then 10 years down the line, spending 10 times as much while losing lives and livelihoods along the way. So if ever anyone says that this type of thing costs too much, it's always important to bring together that reality of what we're actually spending today and how much of that could be preventable spending as well. Surely we enough invest in cardiovascular disease as it is. Now, if that graph alarms you, and I hope it should, that is to scale. That's the amount of money globally that's invested in cancer research versus cardiovascular research. It's also worth pointing out today that out of the over 90 drugs that were approved this year, not one of them last year, not one of them was for cardiovascular disease. Now, that's not to say that this kind of cancer research is not extremely important, but what we're looking for is we're looking for support and policy and investment that is proportional to the burden that cardiovascular disease represents. And that's what we're looking to try and achieve. One that you'll hear all the time, and I'm sure as a community, you're largely aware of it already, but the idea that cardiovascular disease is mostly a male issue, or the drastic underappreciation of cardiovascular disease in women. This is a question that we received from a member of the European Parliament. Do more women die of heart disease than breast cancer? We had to tell them that almost twice as many women will die of cardiovascular disease in every single form of cancer combined in the European Union today. So these are kind of real misnomers about cardiovascular disease that we've been looking to address and to see, can we highlight both the importance of tackling cardiovascular disease, providing a broader framework to have conversations about FH or stroke or any number of cardiovascular conditions, so that anytime anybody wants to talk about their specific condition, there's a broader understanding of that backdrop, which is this is the biggest killer in the world today, and it's something that comes with a huge price tag attached to it as well, but is very actionable. One of the things that we've been looking to do quite a lot, and I'd encourage everybody to have a think about this if they can, is one mistake that we often see made is people targeting a very small minority of policymakers that are interested in healthcare, for which there's a lot of competition. Keep in mind that about 91% of politicians have no role to play in healthcare policy at all. So they might fully agree with you and sympathize, but there's an element of that's not really my job. It would be like going to a cardiologist and saying, we need to clean the oceans. And they might fully agree with you, but they might probably also to say, well, I have other stuff going on. So keep in mind that we need to be able to diversify the messaging so that when we're talking to policymakers, we keep in mind, well, what's their background? What's important for them? So, for example, I mentioned just a minute ago that this misnomer about cardiovascular health being a men's issue. One of the things as each that we've been doing a lot is going to the gender equality committees in parliaments and talking to, and it's mostly women, who've campaigned their whole career for gender equality. And instead of saying, did you know it's the biggest killer? Instead saying, do you think it's right that more women than men will suffer from cardiovascular disease, and yet only 1/3 of all clinical trial candidates are women? So we're not designing our treatments for the people who are most likely to need them. Do you think that it's problematic that 50% of women will wait up to 10 hours before seeking treatment for what are obvious symptoms of a cardiovascular disease? Maybe that's something to do with the fact that we view this culturally as a men's issue. And so all of those policymakers who now support action on cardiovascular health, they're no more interested in health policy than they were before we met them. But they recognize that cardiovascular health and the fight for cardiovascular health is a continuation of the fight they've had their whole careers, which is for gender equality. The same can be said when you talk to union representatives. Don't you think we should better protect workers from the risks of cardiovascular disease? You've supported unions your whole career. This is another step towards that. You can do the same thing when it comes to regional inequalities, pointing out how cardiovascular health is something which needs to be recognized as a source of great inequality. If you're born in Denmark today, for example, over the course of your life, you will have a 24% chance of dying of cardiovascular disease. If you were born in Bulgaria today, that jumps up to 75% chance over the course of your life. So these are the kinds of things that we are bringing to policymakers at the moment, because if we want heavy budgets for cardiovascular health and FH, then we need to be able to appeal to these policymakers and a broader remit for that. So the next question then is, well, is it together to make decisions? That's pretty much it. There's a lot of confusing terminology about it, but suffice it to say, all the agricultural ministers sit together, all the environment ministers, and all the health ministers sit together as well. And how those decisions are made are based on a series of rotating presidencies of the European Council, who just set the agenda for what's going to be discussed. So to answer that question of, is it working, and is the partnership that we have with FH Europe and our other allies within the European Alliance for Cardiovascular Health, has it started to have an impact? Well, this year, the European Alliance for Cardiovascular Health as a community has made some policy history, because for the very first time in the history of the European Union, cardiovascular disease is on the agenda of the Spanish, Belgium, and Hungarian presidency priorities. So for the very first time, the European Council will be talking about cardiovascular health, a sit-down meeting, 27 ministries of health talking about what needs to be done next year, with full conclusions on cardiovascular health. So when we think conclusions, think, for example, the smoking ban that we all enjoy across the European Union. That's a result of council conclusions on cardiovascular health. That's a result of council conclusions on smoking. And we're about to have council conclusions next year on cardiovascular disease. So if you want your politicians to be prioritizing FH and to make sure that that is featured in these and these types of conditions are recognized, then all the more reason again to be talking to your politicians about your types of conditions and what they mean to tackle. There's also worth saying that there's been huge progress over the last year and a half in multiple countries across Europe as well. So we started off with Spain with the first ever cardiovascular health plan in 2022. Poland, Czech Republic, Bulgaria, Croatia, Romania. Just this week, the German Minister of Health announced that they're launching a cardiovascular health plan, and Latvia and Estonia have as well. And they're just the ones that we know of. We frequently have other countries coming back to us saying, yeah, we've talked about this and we're launching a plan with the minister and these types of things. So we're riding a wave at the moment in a very, very good way. Just this week, as another piece of information, and you're actually, I think, the first people outside of Brussels to potentially know this as well, is that the largest political group, the largest political party in the European Parliament, we just saw a draft of their election manifesto for the European Parliament elections next year, and an EU cardiovascular health plan is in there. So that means that if you have a party that is in the centre or centre-right, one of the things that they will be campaigning on is cardiovascular health and the need to properly fund action on it. And this brings us to one of the activities that we're working very closely with the FH Europe Foundation on, which is this exhibition taking place in December from the 11th to the 14th of December in the European Parliament in Strasbourg. A little confusing. There's two parliaments, one in Brussels, one in Strasbourg. But every month, every member of the European Parliament, all 705 of them, need to go down to Strasbourg to vote on key issues. And we'll be doing an exhibition with all of our partners, where we will showcase the 27 individual cardiovascular health profiles of every single country. We will have over 100 delegates, including from FH Europe, coming down to talk to their politicians, tell them about how they need to make action on cardiovascular health an election priority. And importantly, and maybe somewhat transactionally, to be able to help them get out the message that they've made that pledge. One of the things that unfortunately falls down a little bit when it comes to elections is there's a little bit of please sign our manifesto, and then everyone goes their separate ways. But as an alliance, we've all kind of come together to decide that it's going to be important to highlight for those politicians who do make commitments to cardiovascular health. Well, we need to tell our communities about that. We need to let them know. And politicians who have the possibility to reach thousands or potentially tens of thousands of their constituents, that's pretty interesting for them. And suddenly cardiovascular health becomes an issue which they feel that they can run on because they can reach a very wide community of people and voters. So we will be conducting interviews with MEPs where all of the each members and members of FH Europe Foundation will be interviewing their politicians to say, we've just seen the statistics for our country, we've talked about our messages, what are you going to do about this if you're elected? And we have some pretty high targets that we want to reach. So 100 plus advocates coming for these couple of days down to Strasbourg. Importantly, no lectures, just stories. So the only other people who are going to be speaking, apart from the politicians, are patients. There's a lot, and I'm sure many of you are a bit sick of it, there is a lot of tokenism when it comes to panels and when it comes to these types of things. So the issue was, you know what, let's just, we're going to have the statistics, but we're going to need the stories. So let's just people tell their own stories and remind politicians that you're not dealing with the percentage point. You're dealing with a person. And every single moment that they delay funding, screening, and diagnosis and treatment, it reduces the entirety of a unique person's experience down to a number on a page. Our target is 150 members of the European Parliament pledging to support an EU Cardiovascular Health Plan and have this on their election manifestos. And finally, if you want to be able to help on this, there's a surprising amount that you can do. First is, and if these slides are circulated, you'll be able to have this link as well. You can click on that one link that you see there, which is a list of all of the members of the European Parliament for your country. You'll be able to find their social media accounts, follow them, and keep an eye out for activities on social media that they do on cardiovascular health. What we really want is we want politicians to commit to major action, who have control over that 182 billion euro in their budget, and to be able to post something on their pledge, and then a week later for their staff to go, that got a really big response. That's the kind of thing that you really want to have on your election manifesto. We need to keep that there. So, this is something which everybody can play a role in. And when it comes to individual advocacy, I'd just say one thing as well, because we do get the feedback sometimes, a little skepticism about what any one individual could do when it comes to changing politicians' minds. In my experience, most major EU policy has come from individual constituents emailing their politicians and saying, I have a problem and I want you to do something about it. And I will go further to say that pretty much every major political change that has happened has come from committed individuals deciding that they're going to reach out and lobby their politicians to get things done. So thank you very much for your time. I do hope that you will join us in this effort, and we're very grateful to FH Europe Foundation as partners in the European Alliance for Cardiovascular Health for helping getting this issue where it is today and the successes that have been enjoyed. And one thing, and I hope Magdalene, the team, will forgive me for this comment, one thing which I particularly enjoy about the team, about FH Europe, I would apply the term relentless, which is exactly what you need to be when it comes to dealing with politicians, is that the number of times you want to hear you again has to continuously increase until the point where every politician gets a message that this is not a topic that's going to go away. Thank you.
Fantastic. Thank you very much, James, for that great presentation and really outlining the very strategic approach to changing the hearts and minds in the Council, in the Parliament, and of course there's ongoing conversations in the European Commission as well. Any quick questions, comments from the floor or online? I had one thought. I don't know if you're a betting man, James, but at this stage of the campaign, what are the odds on success looking forward?
There's such a thing as tempting fate, Nicola. But I would say better than they've ever been.
Right.
To go in a short space of time to not having cardiovascular health on the agenda at all, to suddenly having it for the first time in 30 years, the subject of 27 ministries of health. And then not only that, to have the largest political group in the European Parliament say they're going to run on this issue. And then on top of that, go from having no cardiovascular health plan in any country in 2021 to now being on the road to having 9 in a year and a half. I mean, I think the tide started to change a little bit, and we're starting to see the momentum. So I think, without, again, tempting fate too much, I think we're in as good a position as we could possibly hope to be at this point. But that's all the more reason why we need to keep up the momentum.
Fantastic. And thank you very much for your leadership here. The idea of FHU Foundation continuing with our relentless approach is really important. Sam, very, very briefly, we're running into the coffee break, so you're challenging people for their cup of coffee. Really briefly. So
for a cardiovascular health plan, do you have like a list of ideal components that should be included in a plan, or kind of a guidance for countries to develop a plan, or are you just looking for any plan?
Great question. So there's two things to attach to that. One, the European Alliance for Cardiovascular Health. So all 17 members have agreed on one document, which is a cardiovascular health plan for Europe. And it lists everything that would be needed from primordial and early diagnosis and treatment, prevention, rehabilitation. We're actually in the process right now of effectively ghostwriting a document for members of the European Council outlining exactly what needs to be in these types of plans. And it's also the case that countries are sharing plans. So Spain, for example, some of the professors I know who've been involved in writing the Spanish cardiovascular health plan are starting to share manuals on how you go about writing a cardiovascular health plan and what are the steps you need to take in order to get there. I'm very happy to connect afterwards and share some of this material as well about what's already out there. But I would just say that the devil is going to be in the detail, and if FH is going to be on that agenda, you need to make sure that you're also speaking up about it.
Great, very good message. Thanks once again for devoting part of your Saturday morning